Hello, Tammy. First off, I think that's great that you're trying to pursue nursing. I think it's also great to ask for advice when practicing for an interview, just because practice is perfect, and also every person has their own way of interviewing and seeing what works for some people, and picking up what you like about what works for them, and making it your own will totally help in your own interview. That's a great topic to go ahead and practice on your brother-in-law. Um, some of the points that he had said where it was be direct and find your own voice, I think it was a great point, because there are so many people that, right, they'll look online and they'll try and see like, oh, if asked this question, how to respond to that. And I mean, those are things you should practice. But by being able to just come from the heart and speak your own truth, really shows how genuine you are. And a lot of people can see um, or like people that are genuine, especially when you're going into the medical field. Being genuine and being honest on how you feel and how you're able to present yourself is a big thing. Um, I also think that how you were saying some of the things that you learned were through the TED Talk and things that you would use during your discussion, was the paraphrasing and how it decreases or even eliminates there being a chance of any sort of misunderstanding, which I think is also great. Been doing that myself, where I will reiterate in my own words kind of what I've heard, just to make sure that we're both on the same page, the person I'm having a discussion with, and to find out that, like, not everybody speaks the same way as I do. So to reiterate what they're saying, you're able to see like, oh, that's actually not what you meant. Or even it doesn't need to be words, right? Because body language is another huge thing, like how you were saying, having more eye contact. That's also a way of showing that you're listening. And so by other people, I guess right, like if I were to talk and I were to just hold my hands or fold my arms across my chest, it may not be perceived that I'm actually relaxing and that's just my way of just listening to somebody, or somebody else will think like I'm taking offense to anything that they're saying. So being able to even like, oh, is there something that you don't like that I'm saying? Is that why you crossed your arms? Just to make sure that, you're perceiving or understanding what they're trying to communicate to you. And it may not always be the case, right? It may be a misunderstanding, and that gives the open opportunity to actively listen to what they have to say and avoid miscommunication. So I think that's another thing too, because that's another point, I guess, even for your interview, is that some people like to play that upper hand, but just trying to not read too into it, or actually reading into it, depending on who the interviewer is, may come in handy, because in the medical field, sometimes, your patients may be not communicating to you everything that they should be, and you may need to be able to look into it. So I do think it's awesome, once again, that you were able to use this lesson this week and improve your communication with your brother-in-law. All right, well, I will see you next time.